When the Roman Empire collapsed, much of the Western world's medical knowledge was scattered or lost. But in the East, a new empire was rising that didn't just preserve the past, it revolutionized it. From the 8th to the 13th century, Islamic scholars turned medicine into a rigorous, evidence-based science. They built the world's first true teaching hospitals and created a global pharmacy by trading herbs and ideas along the Silk Road. In 10th century Baghdad, a physician named Al-Razi, changed how we look at infection. He was the first to distinguish between smallpox and measles, two diseases that had been confused for centuries. He was also a pioneer of the clinical trial. When asked where to build the new Baghdad hospital, he hung pieces of raw meat in various parts of the city. The spot where the meat took the longest to rot was where he declared the air the healthiest. He understood that the environment was the key to recovery. If there is one name that defines this era, it is Ibn Sina, Avicenna. His masterpiece, The Canon of Medicine, was so comprehensive that it became the standard medical textbook in both Asia and Europe for over 600 years. He was the first to realize that many diseases were contagious and could be spread through water and soil. He also explored psychosomatic medicine, arguing that a person's mental state was just as important to their health as their physical condition. The Islamic world gave us the Bimaristan, the true ancestor of the modern hospital. Unlike earlier Roman facilities meant only for soldiers, these were open to everyone, regardless of religion or wealth. They featured specialized wards, separate areas for surgery, infectious diseases, and even mental health. Pharmacy, SRE, in-house laboratories that prepared distilled medicines, syrups, and ointments. Medical records, doctors were required to keep written accounts of their patients' progress, creating a legacy of case studies for students to learn from. How did the Islamic Golden Age affect the human lifespan? The hygiene mandate, religious requirements for daily washing, wudu, and the proliferation of public baths, hammams, created a culture of hygiene that naturally suppressed the spread of skin and waterborne diseases. The rise of ophthalmology, because eye diseases were common in the desert climates, Islamic surgeons became the world's experts in cataract surgery, using hollow needles to extract lenses. By restoring sight to the elderly, they didn't just extend life, they radically improved the quality of life for the aged. The scholars of the Islamic Golden Age were the bridge between the ancient and the modern. They proved that medicine isn't just about healing the sick, it's about the constant, restless pursuit of knowledge and the belief that for every disease, nature has provided a cure.